Hi everyone, Dr. Soni here. I want to thank you for joining us live. Today we're going to be taking a multimodal approach, means we're going to be doing several different treatments, and our goal is really to address kind of this submental or this area underneath the chin as well as the neck region. And you can see there's a little bit of that laxity, there's a little bit of that crepiness that's going on. So the three treatments that we are going to be doing today are going to include something called Radiesse, which is typically used as a calcium-based filler on the face. But one of the properties of Radiesse is that it's a biostimulatory compound, meaning that it can also stimulate collagen. So for the purposes of neck rejuvenation, we're not really trying to fill this area with Radiesse as we would do maybe when we're doing cheek augmentation or jawline. But we're looking to dilute it with some anesthetic and some saline and really kind of make this dilute mixture to serve two purposes. One is we want those particles of calcium being deposited everywhere, where we want some collagen stimulation to occur. So most of it is really going to be in the upper part of the neck, and I'm also going to put a little bit on the mid part of the neck. And because we've mixed anesthetic with the Radiesse, when I'm doing the other two treatments, the radiofrequency microneedling, where the needles go into the skin and they tighten the skin by heating up the skin from the inside. And finally, we're going to finish the top of the skin by doing a CO2 laser. So the combination of these three treatments is going to serve to stimulate collagen, tighten the skin, and help resurface the superficial aspect of the skin. So this is what the Radiesse looks like. It's a calcium-based filler, as you can see here. And then the rest of this is a little bit of saline and anesthetic. So what we're going to do is we're just going to go back and forth, and we want to mix it. So we're going to get a very watery solution, and it's going to really look more like skim milk or kind of watered down skim milk. And this is what we're going to use to inject in the neck area. Yeah. So, and in the interim, like I said, this will help provide a little bit of anesthesia for both the radiofrequency microneedling, because radiofrequency microneedling can be done with topical anesthetic, but if we want to do a slightly more aggressive treatment or go deeper, it can be a painful procedure. So oftentimes what I'll do is, in addition to the topical anesthetic, I'll go ahead and inject a little bit of local anesthetic. And in this case, we've just mixed it with the Radiesse that we're planning on injecting. So you can kind of see the solution now. We've already gone ahead and cleaned the skin with a chlorhexidine solution, which makes sure we have a sterile area that we're going to be working on. And the neck right here, we made a pilot hole, and you can see the cannula go in, and sometimes it can be a little tough to get the cannula in, but here it is. And then just a little bit, you see, I'll just put a little bit of this mixture. As I'm injecting the Radiesse, she's also getting a little bit of anesthetic. Now, again, most of this is just that liquid solution. A little bit on this side. That's it. A little bit. Just remixing the radiesse a little bit, because when you mix it in a dilute solution like this, sometimes it can separate, so we want to remix it again and finish off the rest. Small amounts. And then give it a last little bit. On the lower neck. Check this side and a pinch. How are you feeling?
I'm okay.
Starting to go a little bit now?
Yeah. That's it now.
Good. So you can see it's starting to blanch just a little bit where we injected the solution. Next, we're going to start the radiofrequency microneedling. I also have given her some cold air. Should help make it comfortable, but overall this should be very comfortable because this entire area that I'm going to be working on is going to be nice and numb. This is radiofrequency microneedling. And as you can see, these needles come out of this probe right over here. You okay? You okay? What's
I'm
going
fine.
on?
No, I'm
You
completely.
feel some numb
No,
in your
no.
lips, or
A
you
little
okay?
bit. I'm fine.
You're okay. All right, good.
100%.
All right. So, and as these needles go into the skin, the tip of the needle delivers radio frequency energy, and that results in heat at the tip, which is what results in some new collagen formation and a little bit of tightening of the skin. Now, in general, especially in the neck area, if there's a little bit of the submental fat, we want to be able to destroy it a little bit as well as tighten the skin. On the face, I don't like to go too deep with the radio frequency microneedling because in general, we want to preserve the fat in the face. So when we do the face, we may only go to a depth of 1.5, and someone who's got a little bit of thicker skin, no more than 2 millimeters. Whereas in areas where we're trying to target a little bit of the subdermal fat, we may go deeper, up to 3 to 3.5 millimeters into the skin, because the heat from the tip will also help liquefy the fat, and then we're going to treat multiple layers of the skin to help the tightening. And finally, we're going to finish up with doing the CO2 laser, more for the superficial texture of the skin. So here we go. Again, this should just... How are you doing?
Doing fine.
Is the pain manageable?
Yes.
Okay. So she should be feeling very little bit over here. And again, this entire procedure with the radio frequency microneedling, provided that you've given proper anesthesia, can take about 15 to 20 minutes. And the great thing about radio frequency microneedling is the healing is typically very quick, because remember, most of the energy is getting delivered underneath the skin and into the tissue. So in the upper part of the neck, we are going a little bit deeper, and as we come down to the lower part of the neck, we won't be going as deep. Now, radio frequency microneedling is a procedure that's gotten very popular in recent years, and there's many different devices on the market. Over here, we're using the Secret RF. Many of you may know the Morpheus, which is quite well known. There are other manufacturers that make a similar device, and while they may have some individual differences, the basic principles are very similar. And it's basically, again, these tips penetrate the skin, they heat up the skin. Anna, how's the pain?
No pain, no.
Yeah. And so the upper part is completed. We're just going to finish up the lower part a little bit and then start on the CO2 laser. You're doing okay over here?
Fine.
Yeah. So as you can see, with proper anesthetic, and it really only takes about 5 minutes. We don't always have to inject it with the Radiesse. Sometimes I'll just do the anesthetic agent and I'll tend to inject it because it really makes for a much more comfortable experience. Otherwise, radio frequency microneedling, depending on the settings you're doing, can be painful. So the goal is to certainly make the procedure as comfortable as possible. And we're going to finish up on the other side. And you can see a little bit of that whitening or blanching because we gave her the anesthetic with a little epinephrine or adrenaline in it. The good thing about that is it tends to keep the area numb for a little bit longer, and she'll be numb for about 45 minutes to 1 hour. And the other thing is it also helps close off some of the tiny blood vessels, so typically it can minimize bleeding and bruising. So we've done the upper part, we've done the lower part. And the other thing of note is that I think people are really more and more interested in procedures that really kind of restore the natural integrity of the skin. For the first 2 decades we've been injecting a lot of fillers, and I think people are shying away from fillers both on the face and maybe elsewhere on the body. But these compounds, these biostimulatory agents, when used properly, they don't necessarily create a lot of volume, but they can create a little bit of volume. They can help stimulate collagen. If you put some of these products deep enough on bone, they've been shown to actually help stimulate new bone formation as well. So they really are wonderful, and now we are starting to see certainly more and more of these regenerative therapeutics enter the market. Things like exosomes, PDRN, salmon sperm coming out of Korea. But remember, all of these treatments, like exosomes and PDRN and salmon sperm, they are really only meant for topical use. Right now, none of them really have the FDA approval for injections. And that's why we do rely on some of the other products like Radiesse or Sculptra, which are approved for use on the face and other parts of the body. In some areas, however, they may not be approved, and that's what we call off-label use. Again, you really want to have a conversation with your medical professional or your provider when you are using things that are off-label. But again, the risks of any of these procedures, especially if you're injecting, can include swelling, bruising, potential for lumps and bumps, although we did dilute it quite significantly, the Radiesse, to really kind of make sure the particles are spread apart to prevent that. There's also risk for infection, but we use microcannula. As you can see that there's very little trauma that's visible on the neck. So if you take your time, you can really make these procedures quite comfortable and effortless. And you can see, based on her face, she's very comfortable. She's not in any significant pain. And we're almost done with the radiofrequency microneedling. She's also going to find improvement in kind of some of these horizontal lines or tech lines. Sometimes it's genetic, sometimes it may be from staring at your phone quite a bit. So we have lots of options to really kind of help rejuvenate this area. And you can see, we've done close to 400 pulses, but there's very low redness that we notice to the skin, because again, most of the energy in radiofrequency microneedling goes underneath the skin. That's why the healing is typically quick. And I'm going to finish off with just one last pass in here, maybe a little bit deeper, just to get, and you can see how far the tips come out. Again, we want to remove a little bit of the fat here and tighten the skin. Anna, how's the pain?
No pain.
No pain? Okay, very good. Normally, if we didn't inject the anesthetic, this would be quite painful, because the tip can get quite hot. I think we're done because remember, we have to do the CO2. Now, if I'm just doing the RF microneedling, I may go a little bit more passive, more aggressive. But when you start combining multiple different treatments, you want to be careful. You don't put too much trauma into the skin. You don't put too much heat in the skin. The skin in the neck is certainly a little bit different than the skin in the face. So, just use a little bit of caution. Look at the skin, look at the patient, make sure they're comfortable, make sure you're not seeing any significant redness, warmth, irritation. And now we're just going to put some goggles on her, just to protect the eyes, and we're going to be working on the neck. Now this is a CO2 laser. It's what we call an ablative laser, meaning the way it works is the beams of light, the beam of light that's in the CO2 laser is going to physically vaporize the skin. So it's going to create little micro channels into the skin. And that again is going to lead to collagen formation. You may get a little bit of that superficial tightening, can help with that superficial crepiness. We just did the Radiesse RF microneedling to help with kind of that deeper collagen stimulation and whatnot. And now we're going to do the CO2. We're going to use a rectangular shape. 20 by 20. Maybe 1 to 2 passes. So you can kind of see here that little grid. And you can see that grid that gets created. Each one of those dots represents a singular point of ablation. And so CO2 is a fantastic laser because it can help with sun damage, it can help with fine lines. And it's what we call the gold standard for things like acne scarring. It can help with stretch marks. You doing okay, Anna?
I'm okay, doctor.
You can use the cold air. Anna, she may not have complete anesthetic on the side, and she may be feeling a little bit of that pinching. We're almost done. A little bit of pinching there. There's no anesthetic there. I'm almost done. You're doing good, Margaret. Okay, and that's it. We've completed the entire treatment from start to finish with the Radiesse, with the radiofrequency microneedling, with the CO2 laser. It took about 30 minutes. Most of the procedure she felt very low pain. She did feel some pain down here with the CO2 because it's much more superficial. and we may not have given her adequate anesthesia over there, but again, it's quick. She's going to have a little bit of redness. The skin's going to feel a little bit raw, more from the CO2 than the RF. But over the next week to 2 weeks, the skin's going to heal. The treatment and care is fairly simple. Sometimes after a CO2, we may consider doing some vinegar soaks afterwards. We're doing gentle cleansers. We're keeping it moisturized and hydrated, maybe something like a little bit of aquaphor. The healing is very quick. She may have some discomfort and pain for the next 6 to 12 hours, but that should dissipate fairly quickly in 24 hours. And over the next 4 to 6 weeks, we're going to see collagen stimulation. We're going to see a little bit of tightening of the neck. The skin, where there was a little bit more crepiness, is going to start to tighten and improve. Some of the fine lines and the superficial texture are going to improve, not only because of the radius and the RF, but we did that CO2 laser. And we're going to be posting the pictures as we kind of follow Anna's journey. Hopefully this helped. And if you have any questions, please feel free to ask. Thank you and good night.